Okay, it's time now for our weekly checkup with Dr. Isaac Bogoch, and today we're talking about flu shots. Hey, good morning, Dr. Bogoch. Good to see you. I know we're all still kind of recovering from that Blue Jays World Series loss, but we got to kind of chin up and move on. So we know that flu shots were rolled out to the general public last week, not just to those kind of at higher risk groups. But officials across the pond in England say that more than 250 people there have been admitted to hospital with influenza like late last week, and that the flu season has started unusually early. So are you and your colleagues seeing any indications of that happening here? And could it be a nasty flu season ahead for us?
Yeah, great point. Thanks for bringing that up. I mean, the flu season, as we say, is predictably unpredictable. And we can look at other areas and make reasonable guesses as to how significant our flu season is going to be. But oftentimes those predictions are wrong. Here's what we know. We're going to have a flu season. We know flu can pack a punch. It can infect anybody at any age, but it's especially nasty in the oldest communities and in the youngest communities and people with underlying health conditions. But the flu shots are available for everybody 6 months of age and up. And this reduces your risk of, number one, getting the flu, but also reduces your risk for, number two, if you do get the flu, reduces the risk of getting sick enough to land in hospital. So it's a great idea to get the flu shot. We've got decades and decades of safety data and effectiveness data on this. And yeah, like anything else, you still might get the flu. If you get the flu shot, you're just likely to get less sick. And that's the key point. And there's a lot of it out there in different parts of the world. We're definitely going to see this in Canada. We're starting to see more and more predictably as we enter the fall and winter season, and we'll continue to see more cases. So let's take steps to reduce the impact of this at an individual level and at a community level.
Yeah, and it helps that some pharmacies are also able to administer these shots. Dr. Bogoch, staying with vaccines, we've also talked a lot about RSV, and I know that it's generally given to those in the older kind of age group and also the younger age group. It was made more available to other eligible groups, but is there a test for RSV? And maybe you can break down some of the confusion for people thinking, oh my gosh, flu shot, RSV, COVID? Like, I think people are still kind of wrapping their heads around what's the difference between RSV and flu, traditional influenza.
You're not going to know. Yeah, like you're not going to know,
yeah.
Right? People don't walk into a clinic with a stamp on their forehead saying, this is what you have. And as we've talked about for years, prevention is key. The syndrome is very similar. You can get really, really sick. And just like flu, RSV will more negatively impact the older individuals and younger individuals. And it's a very common reason for admission to emergency rooms, admissions to hospital, and visits to family doctors. There are vaccines for RSV out there. These are, I'm not going to say relatively new because they've now been around for several years. The key that's new is that it's now covered for people over the age of 70 in Ontario. And again, this is just like the flu shots. The RSV shots will reduce the risk of severe infection. You still might get RSV, but it reduces the risk for severe infection like hospitalization and death. And they do a good job. The cool thing about these RSV vaccines is it's not an annual vaccine. It looks like it lasts for at least 2 years, which is really good. Obviously, when they first rolled out, people had to pay for them. They were only covered for a select smaller group of individuals. Now there's much broader coverage. And again, I think we'll see these do a lot of good. We now have several years of safety data and effectiveness data under our belt, and it looks like these are good products that help keep people out of hospital and keep people healthy.
Okay, finally, Dr. Bogoch, I want to talk about COVID because those vaccines are also available. Do you recommend, parents to get their kids vaccinated with COVID-19 shots, or, even adults who might have had 4 jabs or maybe just 2? What is kind of the current recommendation for people to keep updated on these shots? Or is it kind of in the back burner because we're not seeing as much of it and it's not as detrimental as it once was?
Couple of things here. And again, thank you for bringing this up. It's very important because sometimes people will confuse COVID, flu, and RSV. COVID, I think from a vaccine standpoint, the National Advisory Committee on Immunizations, that's Canada's advisory body for vaccination, does a remarkable job with COVID vaccines. And they have 2 categories. There's the should be vaccinated and the may be vaccinated. In the should be vaccinated crowd, it's people at risk for severe infection. Those over the age of 65. those with underlying medical conditions that put them at risk for hospitalization. Okay, if anyone has any questions about who that might be, please speak with a healthcare provider, doctor, nurse, pharmacist, public health specialist, nurse practitioner. There's a lot of healthcare providers to ask if you're in the should be vaccinated category. If you're not, you're in the may be vaccinated category. That's basically everybody else. They're not saying go out and get this, but they're also not saying don't go get this. This is going to be you're not going to make a sweeping generalization for millions and millions and millions of people. Some people will choose to get it. Some people will choose not to. You're in the may get vaccinated category. And again, there's some nuanced discussions that go into this. And it's important to sit down with a healthcare provider if you have any questions about this. You can't make a blanket statement. And I think NACI does a very smart job in terms of how they articulated this in their guidance. And again, anyone watching this who's unclear about what they should do, please speak with someone who knows you and your health well. And that can be a doctor, a nurse practitioner, a pharmacist, a public health specialist. There's a lot of people out there who can help navigate this question if people have it.
Okay, Dr. Bogoch, that is our time for this week. Thanks so much for joining us. And hey, hope you feel better when we chat again with you next week. Take care.